Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. It's my pleasure to be here with my friend Mory Bahar, CEO and founder at Personal Remedies. Mory, great to see you in the studio.
Great seeing you, Logan, as always. Pleasure.
I love what you're doing, really connecting nutrition to chronic disease, really connecting the dots of food as medicine to daily life for people who are struggling with a whole range of conditions. So really break it down for us. What is Personal Remedies and who are you trying to help?
Great. In Personal Remedies, we want to offer fully automated, personalized dietary guidance that takes into account a patient's or an individual's multiple illnesses, health risks, food allergies, preferences, and medications. Okay? So we basically want to be, or I should say we are, an e-Dietitian for chronic
e-Dietitian,
for chronic illness patients.
So I've got hypertension, I've got type 2 diabetes, I'm allergic to peanuts, I've got all these things going on, I'm a little overweight. What should I eat?
Exactly. The challenge our industry has had for a long time, forever, is how to advise people on dietary regimen when they suffer from multiple chronic illnesses.
Yeah, it's just too complicated.
That problem has not been solved, and according to CDC, there is a void of information for those situations. And that is really one of the crown jewels of the company, the fact that we have solved that problem of addressing any combination of 300 different illnesses, diets, and health risks and health topics.
How did you go about cracking that code? I mean, was that a data problem? Was that just a research challenge?
I can't comment on how all others have tried to struggle with this and what was challenging about it, but the way we addressed it is we quantify the helpfulness or harmfulness of a given food item as it relates to a given illness, which itself hasn't really been done. There are no publications, there is no NIH-funded initiative that tells you whether raw oysters are helpful or harmful to, say, pancreatic cancer. And there never will be because nobody can get a patent on raw oysters.
Got it.
So we have solved that problem by taking advantage of the fact that there is a lot of science available about nutrient-disease interaction. And there's also publicly available information about nutrient content of a food item.
Gotcha.
So what our software algorithms do is take all of that science into account, quality of the research into account, effectiveness or relationship, solidity or strength, I should say, of that nutrient and that food item. We take all of that into account in order to establish some sort of a score for the relationship between oysters and pancreatic cancer. Now, once you quantify that, then it's a lot easier to address the multiple health issue.
Gotcha.
Because we sum up the scores. We take all the scores into account for that food item as it relates to every one of those individual illnesses.
Got it.
And in nature, if a given food is good for all these three conditions, then it is also good for someone who suffers from all three. There is no counterexample for that.
Interesting.
If a given food is harmful to conditions A, B, and C, then it's also harmful to someone who suffers from A, B, and C conditions. Are you with me? There is no counterexamples for that.
Interesting.
So that's how we have solved the problem of dietary advice for someone who suffers from multiple conditions.
Okay, do you go directly to the consumer, or are you going to employers or payers or?
Right. We initially started with the B2C model. We developed 44 mobile apps. Each mobile app was focused on one chronic illness and all its common comorbidities.
Gotcha, okay.
Then we realized that's not where the money is for us, because brand matters a lot. If your name is not Harvard School of Public Health or Mayo Clinic, you are not going to get consumers that easily. So we switched our strategy to B2B. And we developed an API a couple of years ago.
Okay.
And I'm delighted to tell you that our API has been recognized by the industry among the most popular APIs in two categories, health and AI.
Two good categories for you.
Two good, hot categories.
Congratulations, by the way.
Thank you very much.
What was it about your API that got you that recognition?
I'm not really smart enough to answer that because another body using their own criteria looked at all the APIs and made those recommendations. But clearly the fact that a lot of people were inquiring about our API, were clicking for more information on the website of the industry to find out more about our API and learn more about it was a key factor. They realized that, hey, there's a lot of interest in this particular API. And there are not that many AI-based APIs, really. 3 years ago, we were listed among the top 14 AI-based APIs, right?
Okay.
And on that list, you had companies like Google, IBM, Amazon.
Wow.
We were the only one on that list that was focused on health.
Really?
Yeah. So this combination of power of AI applied to solving a complex problem in health and nutrition is what that gave us that recognition.
Interesting.
Yeah.
And on all those sorts of, credibility, credentials sort of build on each other and allow you to have these new partnerships like the one that you have, I know, with Amazon Alexa. So tell us a little bit about how that works.
Right. We were really delighted when Amazon approached us. And as you can imagine, it took a while to sign a contract, right? As you know, a partnership with very large companies is like mating elephants. It is done at a high level. It's accompanied by a lot of screaming and yelling. And you have to wait 2 years to get any results. And that's exactly the case. Having said that, credit to Amazon, in record time, they were able to implement this capability within Alexa to make use of our API and make use of our data.
Okay.
And they just went live in July.
Wow.
And I'm sure there's a lot of room for improvement for this, but...
Give me an example of how I might get that information out of Alexa.
You can say today, Alexa, is turmeric good for diabetes?
Okay.
And it will come back and say, according to Personal Remedies,
it'll say that?
Yes, it will.
Oh, wow.
It will say, according to Personal Remedies, turmeric is such and such for this health condition.
Okay.
Now, I must tell you that this is early stages of implementation.
Sure.
So Amazon Alexa, every now and then for certain queries related to health or food, may go and use a different source for answering that question, okay? However, there are some very specific examples that I can offer where you're guaranteed to get an answer that says, according to Personal Remedies, the answer is this.
Yeah.
So we were really delighted about that.
That is really cool. It's very exciting. I'm going to have to try that next time I'm around an Alexa device. Where do you feel like we are at as an industry in embracing the food as medicine mantra? Sometimes it's just a nice thing to say. Sometimes it's just a conversation piece. Sometimes people actually put their money behind it. Do you feel like we're really maturing and progressing towards that understanding? Or do we still have a long way to go?
Okay. You're right that the industry tends to embrace a new buzzword, right? So food is medicine became a buzzword a few years ago, and now everybody tries to somehow connect their company to that buzzword.
Plus AI.
AI is another perfect example. Has been around for 50 years, but it became really hot last few years, and every company now, their tool, their product, their solution is AI-based.
Yeah.
But getting back to food is medicine, a lot of people say food is medicine. A lot of people say food as medicine. But what they really mean, they mean food matters.
Yeah.
They mean nutrition matters. They mean what you consume plays a role in your health. That's really what they mean.
Yeah.
Now, we take it a little bit more literally. We actually identify which specific fruit, which specific vegetable, which specific seed or nut is actually helpful to your unique health profile that is composed of multiple health concerns, issues, and so on. So we actually tell you which food is medicine. We actually tell you also which food harms your health, and you should avoid that, and how harmful or how helpful different food items are. We can, for example, tell a user what are the best snacks for their situation, what are the best recipes for their situation, what are the best choice of fish for their situation, because they are not all created equal. Everybody says eat more vegetables, eat more fruits. All fruits are not created equal. For someone who suffers from, say, pancreatic cancer, a fruit that is very high in fructose is not a good idea. For somebody who suffers from calcium oxalate, kidney stones, having more spinach or kale is going to be terrible for them because they're very high in oxalate, and so on. So we actually have some meat behind food is medicine. Thank you.
Pun intended. Intended.
Food as medicine.
Okay. All right, last question. What are you excited about for what's next with Personal Remedies? What should we be looking out for?
I'm looking forward to partnership because, as we both know, this awareness and sensitivity to food as medicine and making intelligent use of technology to advance healthcare is a phenomenon that everybody's embracing. So I'm really looking forward to riding that wave and attracting other organizations that are into health or grocery stores. All major grocery stores want to do something about this. And on their website, they try to come across as we are paying attention to healthy eating and so on. But most of them, unfortunately, at this point in time, really still fall short of giving people actionable guidance. Just telling people this has more fiber is not good enough. Okay, you got to tell them whether for their particular situation, this is a good choice or not. That's something that we do today, and we would love to make that available to retailers, pharmacies.
I can see thousands of applications, where that knowledge base is useful. The bar is low in terms of how much information we're lacking, and yet my mind also immediately goes to how much more you can do with personalization.
Exactly.
And I'm sure you're thinking about that, but
of
right
course.
now there's so much low-hanging fruit. There's such a need for basic data.
Exactly.
Not even basic, but one level of data. You start to layer on who I am, and my microbiome. And it just keeps going and going and going. So
and unfortunately, the chronic illness situation, we're in crisis mode. We are not going to have enough nurses, doctors, hospitals, clinics to just manage one condition, diabetes type 2. If we don't come up with out-of-the-box thinking, intelligent use of automation and other technologies to address some of these chronic illnesses, we are going to be in a very challenging and tough situation.
Well, Mory, I am very happy that you're working on this difficult challenge. Thank you for coming and giving me an update.
My pleasure.
We'll have to save a conversation about pickleball for the next time.
You got it.
Until then, keep up the good work.
Great. Thanks, Logan.
Thank you.
Take care.